activity and relieved by rest? If the patient said yes, then you need to figure out if this activity is moving the spine or moving the muscles. Because if you're moving the spine and the patient gets pain, and the pain is relieved by moving the spine in the other direction, then think of lumbar stenosis. Patient with lumbar stenosis will have pain with extension of the spine, but if they bend the spine, they relieve the pain, and that's called shopping cart sign. But if the pain comes with moving the muscle, like walking, but the pain stops by stopping, then that's probably a vascular problem. In patients with low back pain, especially the elderly, you need to examine the pulses to make sure they don't have vascular claudication. You need to obtain a careful history because the vascular and neurogenic claudication can occur together. And the problem with lumbar stenosis, the examination of the patient is basically normal in a lot of patients. So when you examine the patient, you are not going to be able to find a lot of findings there. But what if the patient said the pain is not associated with activity? The pain is constant and not relieved. Then you need to think of other things. A pain that's not relieved by rest and is constant may be caused by different problems. One of them is a tumor. And the fourth question, is the pain going to the extremity? Is radiating down to the leg or not? If the pain is radiating down to the leg, that's called radicular pain, like sciatica. If it is not radiating down, that's an axial pain. That's pain in the spine itself. Does the pain go below the knee? That's more indication of a disc herniation. If the pain going one side, unilateral, that's a disc herniation. But if it is bilateral, both sides, that may be lumbar stenosis. So let me repeat that again. The unsteady gait is a serious problem in the neck. It's creating cervical myelopathy, in addition to the low back pain that the patient complained from. The bladder and bowel symptoms, that is Skoda equina syndrome. We got to diagnose it early and fix the problem urgently. Is the pain related to activity? Ask if it's activity of moving the spine or moving the muscles of the leg, because it can be neurologic claudication or vascular claudication. Or is the pain shooting down to the leg, creating what you call sciatica? That's a disc herniation. Is the pain below the knee and on one side or in both sides? One side is a disc herniation, both sides can be lumbar stenosis. Keep in mind, things can be associated and overlap. Lumbar low back pain may also involve the hip, like hip arthritis and lumbar stenosis.